Hi, I'm Dr. Neil Schultz, and this is Viewer Question Week at both BeautyRx. I did.
Okay.
This is Viewer Question Week at both BeautyRx and Derm TV, the third week of the month. Welcome to the July 2012 version of BeautyRx Live. We're on live streaming video. I'll answer your questions about BeautyRx skincare products and related skincare issues. Just to remind you, BeautyRx Skincare is the same patient-proven and award-winning products that have been giving my patients more beautiful, healthier, and younger-looking skin for over 10 years. They address the ageless issues of color and texture, in addition to, of course, those vexing problems of lines and wrinkles. And they do it by stressing the daily use of three very important types of skincare products: sunscreen, exfoliants, and antioxidants. Because BeautyRx skincare products are now available to everybody, and not just my patients, we're doing BeautyRx Live, so I can answer your questions, any questions you might have about these skincare products. And of course, if you have a question, go to BeautyRxLive.com and just use the chat box, put in your question, and we'll get to as many of your questions as we can. So let's get started. My first comment is from Paula. Hi, Paula. And she asks, what's good for pockmarks, pitted scars, and boxcar scars? So actually, we're talking about two different types of scars: scars from acne and scars from chickenpox. And the pitted scars, unfortunately, will only respond to excision. They need to actually be cut out. And we do that with a little procedure with local anesthesia in the office, and we take a little round circular boring instrument and we just pop them out under local anesthesia so there's no discomfort. We sew it up, and that's real easy. With boxcar scars, those are a little bit more difficult because of the vertical walls, but those are scars that are often treated very well with something called subcision, where we take a little needle and go underneath the scar to try to separate the bottom of the scar from the fibrous tissue below, which is holding down that scar, and let that rise up. See how far it rises up? Sometimes we need to put some filler under it to make it come up even further, and depending on the results we get with that, then sometimes we may do laser treatments. And last, in terms of chickenpox scars really are treated very much like the boxcar scars, so we would do pretty much the same type of treatment for those. So thanks, Paula, for that important question, because so many people have scars left over even after they've controlled their acne. We have a question from, it looks like Hermosa. I asked this question on Derm TV, but was wondering, does using a benzoyl peroxide product counteract an antioxidant product? Very important. Benzoyl peroxide on your skin makes hydrogen peroxide. Hydrogen peroxide produces those dangerous reactive oxygen species. Those are the very same things that your antioxidants are there for, to try to counteract and destroy. So those high energy reactive oxygen species don't do damage. The problem here is that if you use the benzoyl peroxide and make the hydrogen peroxide at the same time you have an antioxidant, the antioxidant is going to work. It's going to do what it knows to do, but on the surface of your skin. So it's going to take those reactive oxygen species that are laying on the surface of your skin from the benzoyl peroxide, and it's going to neutralize them. Well, that's great, but in neutralizing them, the antioxidant gets destroyed. So the antioxidant is destroyed while it's on your skin, but we need antioxidants in the skin cells to do what they do best. So you're using up your antioxidants on the surface of your cell before they have a chance to get inside the cell and do what they need to do that's so important, which is to protect the inner parts of the cell, to protect the DNA and the cell membrane and the mitochondria and all the other little organelles from the damage that's caused by the high energy compounds like free radicals and reactive oxygen species. So the bottom line is, yes, your benzoyl peroxide can very well inactivate your antioxidant products on the surface of the skin, so they really should not be used at the same time. We have a question from Laura. I would love to switch to your products. I'm using Obagi. I have a dark upper lip problem. Well, Laura, thank you very much. Be happy to have you switch to BeautyRx products. I will tell you that Dr. Obagi's products are good products, and there is really nothing wrong with them, but I would be delighted to have you switch to BeautyRx products. And for your dark upper lip, of course, you're going to need to use a bleach. And the bleach that I would recommend is Brightening Complex. But the Brightening Complex, which is a non-hydroquinone bleach, it's based on peptides, on botanical peptides. No matter what bleach we use, you have to remember that for dark problems on the skin, the sun can make dark pigment faster than we can remove it. So you have to be committed to using a sunscreen all the time, or else your bleach isn't going to work, because the sun will cause more pigment than the bleach can remove. And the sunscreen that I would recommend, of course, is the Maximum Solar Defense Sheer Cream SPF 50. And that is a very light sheer sunscreen. You would use it every morning and reapply it every 2 to 3 hours and every time you swim and sweat. On top of that, you can put the Brightening Complex, which is the bleach. But in the evening, you should be using a BeautyRx exfoliant, and depending on your skin type, you would start with either the Daily Exfoliating Therapy Serum or the Daily Cream, which is an 8% product. That would go on first in the evening, and then the Brightening Complex would go on top of it. And those are the 3 products that you need to start with for lightening dark pigmentation. So these are all available on the website. And if you have any questions after you've started to use them, please get back to us either through BeautyRx Live or by calling the helpline, and we'll be happy to help you out. Again, this is the July edition of BeautyRx Live. And if you have a question, please go to beautyrxlive.com, use the chat box, and submit the question. In addition, for those dark spots, sometimes we use some vitamin C, but that would really come afterwards, after you've gotten involved in the regimen with the 3 products that I mentioned, the Brightening Complex, the exfoliant, and of course the Sheer 50 chem-free sunscreen. So Paula asks, how long do BeautyRx products last? Can I use chemical exfoliants twice daily? In terms of how long they last, their shelf life can be anywhere from 2 to 3 years to longer than 5 years. If you have a product 5 years, you're not using it. So realistically speaking, sunscreens should be used up certainly in 2 days for the body in 2 days or 3 days, and your exfoliant products probably in a month or 2 months. Your cleansers and toners, the same thing if you're using them regularly. But the bottom line is the stability of these products is exceedingly long. And while the over-the-counter products, which are regulated, have expiration dates stamped on them, the non-regulated products like the cleansers and toners and shampoos and the exfoliants, they don't have expiration dates, but they go for years and years and years. And the best way to figure out if you're having a problem with your product is take a look at it. Does it look like the 2 phases of the product have separated out? Does the liquid look like it's separated from the cream? And I believe that there was a second question, and that was, can you use exfoliants chemical exfoliants twice a day? You really can. It depends on the strength of the exfoliant, your experience with exfoliation, whether your skin has become acclimated to it. So a lot of my patients who are using BeautyRx exfoliants in the evening, whether it's the 8% serum or cream or the 10% pads, or even the maximum strength, which is 15% cream or gel, a lot of those patients are using exfoliating green tea in the morning. And the exfoliating green tea has a 10% glycolic product in addition to green tea and an SPF of 20, which is a great combination product because it gets an extra boost of exfoliant in the morning while using a sunscreen and getting the soothing effects of green tea. So the answer is, but you can't start by doing exfoliation twice a day or else you might get irritated. So you've got to work into it. I'd like to address Tom's question, which is, what is the free acid in my 2 BHA products? 2% BHA. One is a liquid. Its pH is 3.2. The other is a gel at 3.6. I seem to get the same results. They recommend the gel in the morning and the liquid in the PM. Actually, Tom, beta hydroxy acids aren't like alpha hydroxy acids. They don't work on the basis of binding of like glycolic acid to proteins. So in your 2% BHA, which has got to be salicylic acid, you got 2% salicylic acid. And the one which has the lower pH, the 3.2, is probably 5 to 8 times more acidic than the one with the 3.6. And you seem to get the same results, so I would use the one with 3.6 because that's less acidic and therefore less potentially irritating. We have a question from Anne. I get some pimples on my face that are very itchy and juicy. I love juicy pimples. Even though I eat healthy, I exercise on a regular basis, it won't go away. I've had this issue ever since I was a child. Do you have any idea what this is? It's usually on my cheeks. Thanks so much, Dr. Schultz. Well, from what you're telling me, when you say that they're juicy, I assume you mean that there's pus in them or fluid in them. And because they're on your cheeks and you've been getting them such a long time, if they are acne pimples, then it's more in the rosacea family and should be treated the way we treat any acne pimples. But the real question is, if you've been getting them since you're a child, since before puberty, I think that you really need to check with the dermatologist and when they're broken out and make sure they are acne and that they're not something else. Because there are other conditions that can cause bumps with fluid in them on your cheeks that have nothing to do with acne. Some of them are sensitivity to sun, some of them are allergic reactions. So I think in this case, because you say that they're occurring since you were really much younger, maybe it's best to get the opinion once of a dermatologist. If they pop out and you have a chance to get a good close-up picture and you want to send them to me at Derm TV or at BeautyRx, I would be happy to try to look at them and get back to you. But of course, we get a lot of requests like this, but I would do the very best for you that I can. We have a question from Shri. If you have a pimple or acne appearing on your face or body, what can you do to avoid it from leaving a mark or black spot? Shri, the most important thing you can do is not to pick at it. The most common problem we have from picking at acne is not scars. It's darkness, it's pigmentation. You see, your skin is very smart. Of course I think it's smart. I think the skin is everything. But your skin is very smart in that it tries to protect itself from injury. One of the ways it does that is by trying to darken in response to injury. Because while your skin is very smart and thinks that if it darkens in response to a sunburn, by darkening, it therefore will not allow as much damaging ultraviolet light to come through the next time, so it sort of protects itself. Well, it sort of outsmarts itself occasionally because it creates that darkening in response to all injuries. You get a burn when you're cooking. First it's red, then it turns dark. You have a pimple or anything else on your face. If you keep rubbing it and picking at it and scratching at it, you're going to injure the skin, and in response to that injury, it turns dark. So the most important thing you can do is to not pick at your pimples. There are some people who have very, very reactive melanocytes. Those are the pigment cells that make your brown pigment. And if they're very reactive, then even just from the injury of the pimple without picking, those people sometimes will get a brown spot or a darkening just from the pimple. In that case, the best way to prevent the brown spot is to prevent the pimples. Get the pimples treated. Conventional things: salicylic acid, sulfur, resorcinol, topical antibiotics, benzoyl peroxide. We've got so many different chemicals that are effective spot treatments for pimples. And if despite that you're still breaking out and your reactive pigment cells are still causing brown spots, then get a bleach. BeautyRx Brightening Complex, over-the-counter hydroquinone 2% products like Porcelana and other products that will help bleach that brown pigmentation. But the best strategy here is don't pick and try to prevent getting pimples. So again, let me remind you that this is July BeautyRx Live. If you have a question, please come to BeautyRxLive.com and type your question in the chat box, and I'll get to as many of your questions as I can. Question from Sophia. What can I do if all sunscreens break me out? I'd like to enjoy my summer without damaging my skin. Sophia, I'm on your side. I think you should be able to enjoy your summer without damaging your skin. What I have found is that people with very, very sensitive skin do much better with chem-free sunscreens. those are the ones with zinc and titanium in them. And the smaller the particles of zinc and titanium, such as the micronized ones, which is the way most of the ones are that are chem-free today, the less apt they are to cause irritation. Because these elements, these metallic elements, are just much less apt to be reactive than are the traditional carbon-based ingredients in regular traditional sunscreens. But there's one more trick, and that is, with these chem-free sunscreens, because the particles are so tiny, they spread and spread and spread. You don't need a lot. You need much less of this, a third to a half as much of this as you would use with a traditional carbon-based sunscreen. You want to put on a very thin layer. And when you're finished putting this sunscreen on, it should be sheer, it should be invisible, you shouldn't be able to see it, and you shouldn't be able to feel it. And that's one of the reasons that so many people love the BeautyRx Maximum Solar Defense Sheer Cream SPF 50, and even the chem-free SPF 30, because they are both chem-free and they both have these microparticles. And I will bet you that if you try either of these BeautyRx products, that they won't break you out if you use a very small amount. I've been through this so many times with so many people who've had this problem, and they use either of these products and they don't break out. Just one more suggestion. First time you use it, use a tiny bit, half of a match size amount, on an area the size of a quarter right in front of your ear. Put that on 2 or 3 times in the course of the day. Do it for a day or two, and make sure that doesn't break you out. I don't think it will, and as long as it doesn't, then you can use it on the rest of your face. Question from Barney. Why is sunscreen recommended for people who have limited sun exposure? Well, Barney, that's because sun damage is additive. It's additive meaning it's like there's a meter in your skin. Every minute that the sun hits your skin adds up. 2 minutes in the morning, 4 minutes in the afternoon. Hey, that's only 6 minutes that day. 5 days a week, 6 minutes, that's a half an hour. That half an hour of those 5 2 minutes and 5 4 minutes is, at the end of the week, it's like being at the beach on Saturday for 30 minutes without sunscreen. Would you do that? I hope not. That's why it's so important to use a sunscreen every day, so it's there when you need it, not just when you think you're going to need it, because I promise you, if you don't put it on first thing in the morning every day, you're going to be caught outside without sun protection. And because this is additive, I mean, it's almost like calculus. An infinite number of infinitesimal tiny little exposures still adds up to real sun damage, whether it's degenerative damage, like the broken things that the sun does to your skin, like lines and wrinkles and brown spots, or the precancerous things like keratoses and precancerous dysplastic nevi, or actual skin cancers. So even if you think you have limited sun exposure, you need to use your sunscreen every day. It's that way it will be there when you least expect to need it. Okay, question from Maria. Is it important to wear lip balm with SPF when going out in the sun? Maria, your lips are another form of your skin. They are particularly sensitive to sun damage, especially your lower lip, because your lower lip tends to have a horizontal surface, which means the sun rays, the harmful ultraviolet rays, which come from above, if your lip is horizontal and those rays are coming down, those rays hit the lower lip in a perpendicular fashion, which has an even more harmful effect than the rays that just glance off the side of your skin. And don't forget, that skin, which is a mucous membrane, doesn't have the thick dead layer, which affords a little bit of protection. So it's even thinner, and it's in a position where it gets more harmful exposure because of the angle. So you definitely need sunscreen on your lower lip. And as long as you're going to put it on your lower lip, you may as well put it on your upper lip. And there are so many lip balms today that have SPF of 15, 20, 30. No reason not to do it. By the way, there's one other place above your neck which so commonly we ignore and gets burned. You know where that is? It's right over here, at the top of your ear. So besides treating your using sunscreen for your lips, make sure you use sunscreen on the top of your ears, another neglected area. I'm just taking a look at some of these really interesting questions. I love it. And you guys and you girls are really, really into this stuff, and that really pleases me, and that's why we're doing BeautyRx Live. Ellen asks, what kind of eye cream should I buy to treat puffy eyes with some wrinkles? Ellen, you're talking about two conflicting problems, puffy eyes and wrinkles. So for wrinkles, we often want to use creams that will add moisture, because by adding moisture, we create a little bit of swelling, and temporarily, that can then take away those wrinkles. But we don't want to add swelling to puffy eyes, because puffy eyes are already swollen. So we really have to decide which we're going to treat. And if we're going to treat the puffiness, we want to use things like tensors, which contract, or maybe even cool compresses. The evaporation causes cooling, that causes some contraction. There are some people who like to put half of their salad on their face with cold cucumber slices and things like that, and cold potato slices. They are astringent, believe it or not. These things, hey, I don't make up the rules, I just report on the facts. These things actually work. And on the other hand, for the fine lines and wrinkles, again, moisturizing creams, short-term, even tensors will help on those short-term, and long-term peptide products, exfoliants, and things like that. But bear in mind that if you're doing it at the same time, you have to be careful with things that may cause a little swelling for the wrinkles, because it'll make them look better, but it's going to make the puffiness a little bit worse. So we have a question from Adora and Laura. Hi, Laura. Adora, I'm going to come right back to you. Besides the sunscreen, what extra protection should I use on my upper dark lip area? I was told the vitamin C serum. I asked because I find my upper area of my lip gets darker when I leave the pool, even when I wear a hat and Obagi 50 SPF sunscreen. Well, the vitamin C, Laura, of course, helps reduce tyrosinase. And tyrosinase is the enzyme that turns the precursor into the actual melanin pigment. So vitamin C helps prevent pigment formation, so vitamin C is helpful, but I think the problem that we're having here is that the sunscreen is not staying on or not being reapplied often enough. Because if you use the Obagi SPF 50 and you're wearing a hat and you're reapplying it, that really should afford you sufficient protection to not get that IPD. IPD is immediate pigment darkening. So I'm going to suggest that you make sure that right before you go in the water, you put your sunscreen on. Don't forget, these physical sunscreens, and the Obagi SPF sunscreen, I believe, is a physical blocker. And if it's not, then get a physical blocker like the Sheer 50 from BeautyRx we discussed before. But don't forget, physical blockers work immediately. You don't need to wait a half an hour for them to become active. So put a physical blocker on before you go in the water. Of course, give it a minute or two to set. I love the fact that you're wearing a hat. If you're wearing a hat, let's make sure that the brim is 3 or 4 inches to really give you some shading. Having said that, of course, you know 80-90% of that sunlight can be reflected right off the water, whether it's the ocean or the pool. So you still need that sunscreen. You still need that protection, the shade protection. And let's try that and see if that doesn't, in fact, help you. And, of course, let's make sure that you're using a bleach at least twice a day, because the bleach, in addition to preventing new pigment from coming, is going to immediately help tone down the pigment that would come if you just didn't cover it enough with the sunscreen, or if some of the ultraviolet light got through the sunscreen. I should mention one other thing, Laura, and that is that the Chem-Free SPF 30 from BeautyRx is also an excellent product for that. And at another time we could discuss subtle differences between them, but the Chem-Free 30, again, is just zinc and titanium and will work immediately. I'd like to come back to a question here from Adora. Despite having no visible lines, I've started using Botox last year to prevent wrinkles on my forehead. Great idea, preventative medicine, and that's terrific. At my first visit, they gave me 20 units. My eyelids were slightly droopy afterwards. That's very sad. I went to a different place the second time, and they insisted that I needed 47 units. This doesn't sound like a happy story. They promised that my eyes wouldn't be droopy, and the additional units will prevent crow's feet. The result turned out to be the same as the first time, with bruising at the injection sites. My questions are, how can a patient know how many units she will need? You really can't know that, Adora. You're going to have to depend on the advice of the professional, and I will tell you that I have never used 47 units in the forehead of any female for lines like this. The most I've ever used is 24 units, and unless the 47 units was being used for crow's feet or for frown lines in between your eyebrows, that's an awfully high dose of Botox. And I think that I'm going to have to suggest that maybe you need to try a third source. What you might consider doing, there are two ways to go about this. One is speak to a friend of yours who's been getting Botox, who's happy, who's satisfied. And maybe you might consider going for a consultation, just for a consultation, to after this Botox wears off, and see what that doctor says and see whether it's making sense to you. And the other, of course, is you can go to aad.org and use, that's the website for the American Academy of Dermatology, and use their physician finder, and you'll find a board-certified dermatologist who specializes in Botox, and maybe you want to get an opinion there. Let me come back to your questions. How can a patient know, and how can one know that they are all administered? You can't. You've got to go to a trusted professional to know that 47 units really went in, although next time you don't want 47 units in your forehead, because I think that could be too much. Why do I get bruising from one office and not the other? That is part luck, but partly technique. And bruising can best be avoided, number one, if the physician goes very slowly after each injection, applying pressure to the area. Number two, by looking for the veins and trying to avoid them. And number three, by your being off of all products for at least a week before you get your Botox injections that contribute towards bruising. So I'm talking about aspirin and all of the non-steroidal anti-inflammatories, those NSAIDs like Motrin and ibuprofen and things like that. Adora then says that in your book you mentioned that the three types of skin aging are color, texture, and contour. Actually, those are the three types of skin problems that we see, not just from aging, but from all sorts of things. We all know about exfoliation for color and texture. What can we do about contour? Are there exercises for facial muscle? Well, contour improvement is often based on lasers, fillers, Botox, but please not exercise. And this has been a controversial point in the past, but I really believe that facial exercises do more to harm than to improve, so I don't recommend facial exercises. And if you want a further explanation of why and how I believe that causes unnecessary stretching of the skin, and you only have a finite number of stretches before you get premature wrinkling of your skin, take a look at the Derm TV episode on facial exercises, because that I think that would more thoroughly answer your question. And Adora, I really want to thank you for these well thought out questions. They were comprehensive, but they really all were quite relevant to the issues that so many different people have. So let me remind everybody that this is BeautyRx Live. If you want to ask a question, please go to BeautyRxLive.com and put your question right into the chat box, and I'll get to as many of your questions as I can. We have a question from Sam, and Sam says, what is your skincare routine, Dr. Schultz? I have to say, your skin looks great. Sam, thank you very much. Genetics rule, and so I sort of have a head start because my mother had beautiful skin, and I inherited beautiful skin from her. Number two, I really do hate the sun. I never sit in the sun. I wear sunscreen every day. I do all of the things that I tell all of my viewers to do. I use sunscreen every day. I put it on first thing in the morning. I exfoliate regularly. I use antioxidants. I don't overstretch my skin, and I just take good care of it. My nutritional status is pretty good. I eat pretty healthily. I eat foods with antioxidants in them, but I apply topical antioxidants. But I follow my own advice. And I thank you very much for the compliment. And I treat myself, I treat my family, I treat my friends, my patients, and my viewers all the same way. And I am passionate about the value of using antioxidant sunscreens and exfoliants every day. So why don't you give it a try? And I bet that you'll see a difference if you do that. And by the way, in Derm TV episode number 6, that particular episode is about the 3 daily essential skincare products that I just mentioned. You might want to take a look at that. It's a 2-minute video, and tune in. We have a question from John. What's good for boxcar acne scars, John? Actually, we got to that at the beginning of the episode, so I'm going to go past that. And in 2 weeks, when the episode is posted, you'll be able to see the answer to that and hear the answer to that. And then we have another question from Shri. Hello, Dr. Schultz. You're awesome, and appreciate your answering our questions and concerns. Shri, thank you very much. You're going to make me blush. Lately, I've observed that I've been getting tiny dot-like moles that are red or green in color all over my body. How can we avoid getting these, and how can we remove these effectively? Are there any home remedies to get rid of them? Well, Shri, I'm not really familiar with green ones, unless, no, you don't eat a lot of green cheese, do it? You know I'm kidding, I'm teasing. You know, we have to have some fun here too. The red ones are easy. The red ones are enlarged blood vessels. They're called cherry hemangiomas. They're hereditary. Most people know which one of their parents they can say thank you to for giving them to them. We get more of them as we get older, and they look just like these little half cherries just sitting on the skin. They're bright red. They gradually get larger, and they increase in number as we get older. They can start even as early as in your teens and 20s, and they're really easily treated with laser treatments, but there's no at-home remedy that's going to get rid of them, because they actually are a little growth of blood vessels, and you just can't get rid of these with at-home treatments. I'm sorry. In terms of the green ones that you're talking about, perhaps they have a tan brown hue to them, and if they have sort of almost a little greasy appearance on the surface, which might impart a slightly green color, those would be seborrheic keratoses, and those are a second type of normal, benign, unimportant, only cosmetic, age-related keratosis. They, again, you're not going to get very far with home treatments, but you can get some improvement with those by using regular exfoliation, because these are slight growths that have a lot of dead cells on the surface, and exfoliants can make them a little duller and a little bit flatter and make them a little less apparent. And of course, the BeautyRx exfoliants that you would use for something like that on your body, you could certainly start with the 10% pads. You don't need to start with the starter strength of 8% serum or cream on your body, because that skin's a little bit tougher. And Shri, again, I hope that you're having a good day, and I had a little fun with you with the green cheese, but thanks so much for your questions and for tuning in. Well, apparently Shri hasn't given up on me, and so I'm going to come right back and see if I can help you again. She says that she never picks at her pimples or acne. Still, it leaves a dark spot on your face, and I mentioned that can have. What specific product would you suggest as spot treatment for these pimples or acne? Are there any BeautyRx products for the same? Yes, Shri. First of all, again, this is going to be like treating that dark upper lip from a previous question. So, first of all, we want to use sunscreen, chem-free, 30 or 50 from BeautyRx, to stop the additional darkening that occurs once you get the brown spot, because the sun just pushes and drives that pigment as soon as the sun shines on it. Number 2, we want to use brightening complex, which is that peptide-based non-hydroquinone bleach, at least twice a day. And third, of course, we want to use an exfoliant to peel off some of the layers of dead cells that already have too much pigment in them. And since this is on your face, I would start with the 8% cream, the daily exfoliating cream, or the 8% daily exfoliating serum, depending on your skin type. Now, I'm going to assume that because these are coming from pimples, that you have oily and acne-prone skin. So, of course, you would start with the serum and then work your way up after a few weeks to the daily to the advanced exfoliating therapy pads. But work at it. I promise, if you use this combination of ingredients, you're going to see improvement. We have time for 2 more questions today, so let me see what I can find here. This is a comment from Jan. This is a question from Jan. I'm using a chemical exfoliant. Should I also be using a physical exfoliant? If so, how often? Jan, I'm such a proponent of chemical exfoliants over and superior to physical exfoliants, particularly for facial rejuvenation. I think with chemical exfoliants, you get more predictable results, you get more consistent results. Of course, you have to prepare your skin the same way every time you use your chemical exfoliant with the same cleanser and toner, so there's no dirt or debris to impede the penetration of the active ingredients in your exfoliant. The time when I tend to add physical exfoliants to chemical exfoliants is with people with really thick, sebaceous, oily skin, or when we're treating enlarged pores. Because when we're treating enlarged pores, we want to get a real synergy between the exfoliation of chemical exfoliants to help dissolve the dead cells on the surface around the pores, and even to help dissolve out the clog or the plug. And we want to use a physical exfoliant like a granular cleanser, which actually helps to get into that clog and help physically pull out the clog. But for them to be most effective, you got to use them at the end of the shower after your face has been steamed. And I think one's face at home gets steamed most effectively in the shower rather than just over a sink with hot water. And I have time for one more question, and we're going to take this question from Laura. One last question, I promise. Fair enough. I've ordered a cart of 4 items ready to purchase from BeautyRx. The vitamin C serum is one of them. When should I use that? The vitamin C actually is used after the brightening complex, and first use your exfoliant, then use your brightening complex, and then you use your vitamin C. And I should use the bleaching cream in the morning and evening. Yes, you should use it both times. The bleaching cream I'd like you to put on after your sunscreen in the morning because, again, we always want sunscreen as the first thing on our skin. After that, for it to work most effectively. And after that, we'll put the bleach on. Will the bleach have a little bit of trouble penetrating through the sunscreen? Perhaps. But again, it's much more important to prevent further darkening than it is to maximally remove the darkening, since the further darkening can exceed our ability to reduce darkening. Then in the evening, you're going to use your exfoliant, you're going to use your brightening complex, and you're going to then use your vitamin C. So that's the order of the regimen. And if you have any questions, you know where to reach us. You can come back to us next month at BeautyRx Live. Of course, you can reach us through the toll-free number on the website. And I want to tell you, it's been a lot of fun today answering all of your questions. I just love your questions. Please join us again next month. Keep sending your questions to Derm TV. So many of the episodes that I'm doing these days are coming directly from your great questions. Keep asking. Stay protected from the sun. Enjoy the rest of your summer. Remember, I never tell anybody to stay out of the sun. I tell you how to protect yourself from the sun. And from Dr. Neil Schultz at BeautyRx and Derm TV, enjoy the rest of your summer, and I'll see you next month. Thanks very much.